Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Josh Hartzell. He's an internal medicine and infectious disease physician. Today's Kevin MD article is Leading with Care, How Healthcare Leadership Can Transform Patient and Provider Well-Being. Josh, welcome to the show.
Thanks for having me, Kevin. Glad to be here.
All right, so tell us a little bit about yourself and then jump straight into the article and tell us about it for those who didn't get a chance to read it yet.
Sure. So yeah, as you mentioned, I'm an internal medicine and infectious disease physician. I recently retired from the U.S. Army and military medicine after about 25 years. And while I practice medicine, I'm also a advocate for leadership development and really spend a lot of time doing faculty development as well. So the article is based off of a book I recently wrote, Prescription for Caring and Healthcare Leadership, Building a Culture of Compassion and Excellence. And it's a compilation of sort of years of living within medicine, but also learning from military leaders and others. And the bottom line is that as leaders, we need to do a better job of taking care of our people. And if we do take care of our people, they will take care of the mission. And the article that I wrote for your blogs is really just a few ideas from that and a few ways that people can intentionally care for the people that they lead for.
All right. So on this site and podcast, we always talk about things like clinician burnout. Burnout rates are exceeding 50%. How much of a role does leadership play in potentially contributing to clinician burnout?
Yeah, it's a great question. I think there's a lot of data. Kate Schoenfeld has definitely published on this, that leadership has a direct influence on both burnout and satisfaction. And I always ask people, think about the best leader you've worked for. And when you think about that particular leader, my guess is you were probably less likely to be burned out. You were excited to go to work. You didn't want to let that person down. And that person probably in some way or in many ways took care of you personally and professionally. So I think the more effectively we lead, the less likely people will be burned out. The other thing that I think we see over time is that as healthcare leaders, we really need to change the system. Mm-hmm. So the system wasn't necessarily or hasn't evolved to best support us. And it's really going to require leadership and advocacy by healthcare leaders to change that system to, create a culture that allows us to thrive.
In your article, you talk about this term, caring inspired leadership. Tell us what that is and how that can apply to healthcare leaders.
Sure. So over time, I really, spent a lot of time thinking about leadership. And when I thought about it more, the thing that came back to me over and over was just this idea that as leaders, we need to take care of our people. Mm-hmm. And a lot of that comes from my influence of being in the Army for a long time and being taught very early in my career that my job was to take care of the people I was leading. And I think it took a long time actually for that to translate to, oh, you should be doing this in healthcare as well, not just sort of in Army roles. And then when I thought about it more, it sort of dawned on me like, oh yeah, like this is what I can do every day. What are the things I need to do to help support my team so they can be effective? Maybe that is just setting high standards for them so that they know I want the best for them. Maybe today they need a piece of feedback to help them on a skill that they're doing or trying to develop. Maybe they need me to delegate an opportunity to them so that they can stretch and grow. Mm-hmm. Maybe they just need me to come alongside of them and ask, hey, are you okay? What's going on? And support them, with something that might be happening in their life. But I think as I really, really sort of dove into this, and then as I looked in the broader leadership literature, I realized that there were other people out there writing about this specific concept of caring leadership is what Heather Younger has called it. Mark Crowley, who's an author, has wrote Lead from the Heart. And there's just sort of this central idea that leadership has to start with caring.
So in the healthcare setting, what are some examples of what that would look like?
Sure. I think one of the biggest things is, how can you support the people that you work with? And I'll give, delegation as an example, because I think you mentioned burnout earlier. And one of the reasons I think in healthcare we get burned out is we try to do too much ourselves.
Yeah.
Which is maybe a good thing in some ways, but yet in other ways it's not. So, we delegate based on people's roles and tasks. There's certain things people should be doing and we should delegate to them. When we don't delegate to them, it actually sends a potential message that we don't care about them or we don't value and respect the work they do. Even though our goal is like, hey, I don't want to make Kevin do that extra work, so I'll just do it myself. You might think, well, why did Josh not let me do my job? Conversely, there's situations where I might have an opportunity and think to myself, you know what? If I delegate this to one of my junior faculty, it'll be a great opportunity for them to develop a budget, for example, or maybe to lead a meeting that we're having a change initiative. And by delegating that task to them, it's a growth opportunity for them. Now, when I delegate it to them, I can't just, dump and forget. I have to delegate it and then coach them to be successful. So I think when we delegate, there's a lot of caring that goes into it. And in some ways, when we frame it as a caring activity, I think it's easier for us. It's easier for me to say, hey, I'm going to delegate because that's your job, because I value and respect what you do. I also value and respect my time, which I need to protect. Or, hey, I want you to do this because I care about your professional development. So I think that's one example centered around delegation.
And then when you delegate, it really empowers them. And I think that in itself is a pretty powerful act.
Yeah. I mean, I think early in my career, when I had opportunities where someone, more senior was like, hey, Josh, why don't you take this and run with it?
Mm-hmm.
Yeah, you feel good about that. You're like, oh, wow. Like, he or she must really think that, I'm capable of doing this. And then what do you want to do? You want to do a good job, right? Because I don't want to let Kevin down because he gave me this amazing opportunity.
Now, what are some of the obstacles that currently prevent healthcare leaders from achieving that aspiration?
Yeah, probably more than we can discuss here. A couple of them I think are one that I've been thinking about a lot recently is history and tradition.
Yeah.
We do a lot of things simply because that's the way we've done things. And I think we've gotten to a point in healthcare where we really sort of need to step back and almost, get up on the balcony and look at things and ask ourselves, hey, why are we still doing it this way? Why do we have this scheduling system? Why do we work these hours maybe? I think we need to challenge ourselves to think outside of the box. I mean, we've got great new technology. We've evolved a lot, but our actual system has not.
Mm-hmm.
And I think that's one of the things that's holding us back. And our job as leaders is to, as you mentioned earlier, empower particularly frontline workers and ask them, hey, what would make your job easier? How could we do this more effectively? Because I think a lot of times what we've seen is people that work on the front lines, they actually know and have solutions, but we haven't created the space where they can bring those forward and then given them the resources to actually make them, take effect. I mean, let's just think about telemedicine. Had it not been for COVID, we probably would have maybe half or less of what we do telemedicine wise. It would have taken probably another decade to get where we at just because of all the red tape and policies. But because we had a crisis, all of a sudden telemedicine, advanced way beyond, I think, what a lot of us would have thought it would have.
Now, in your article, you also talk about the importance of gratitude in terms of creating that environment of caring leadership, right? So tell us about that.
Sure. And I think there's two things with gratitude that I like to emphasize. So one is, the people in healthcare do amazing work every day, day in and day out. And when I say the people, I truly mean all the way from like the person who meets you in the garage to the person who helps you leave the hospital, right? Every single person in between. And all of them have the same mission, which is patient care. And I think sometimes that gets lost on the non-clinician staff. I think part of our job as healthcare leaders is to help them recognize their value and impact, which will hopefully inspire them to continue to do great things to support our patients, but also to support us. And by, saying thank you, by recognizing their work, it helps them feel valued.
Yeah.
The same would go for, physicians, nurses, physical therapists who, can sometimes go a long time without actually somebody other than a patient saying, hey, look, I just saw what you did the other day with that family when you were dealing with them. Like, that was a really challenging situation, boy, I appreciate how well you handled that. And like your nursing level was just through the roof, right? That should be the norm, but it's not. I mean, I tell a story in the book where I had a colleague who worked for several years and really no one in the leadership had thanked her over that period. The other thing that sometimes is missed with gratitude is it's beyond just thanking people for the work they do. Thank yous are cues for what we want in our culture.
Hmm.
So if I want civility and respect or great customer service from my front desk staff, when I see that, I need to recognize it and thank them for it. And then that's a cue to them like, oh yeah, I need to continue to do that, or I need more of that. The example I like to give is sometimes when I'm sitting in a team room and someone calls a consult and you can tell there's a little bit of tension in the call. And when it's over, I'll just thank the, resident or intern or whoever made the call. Like, hey, I could tell that sounded a little challenging, but I really appreciate how you maintained your civility. You were positive and you got the job done. Like that could have definitely went a different way. So thank you for being that person who, is helpful and courteous to everyone else. Boom. That's a cue to them. Yes, I need to keep doing that. So it's both to recognize people for the amazing work, but also to help build your culture with the behaviors that you want to see in it.
Now, can you share perhaps a turnaround story of a hospital, clinic, institution, or medical institution that maybe implemented some of these techniques from caring inspired leadership and really moved the needle and kind of went from a little before and after picture? Do you have a story that you could share with us?
Sure. And this is not my institution, but I interviewed Greg Argyros, who's president of Washington Hospital Center MedStar in
Yeah.
Washington, D.C. And he gives a really good example of when he took over as chief medical officer. And he started doing town halls. And I think we've all been to town
Yeah.
halls, and a lot of times we kind of roll our eyes and are like, leadership is here, but are they really listening? But he went and he took his communications team with him and he took someone to track like the input they got. And
Yeah.
they tracked it all. And not only did they track it, but they actually worked through the problems and tried to solve them. And when they couldn't solve them, they tried to communicate back to the team why they couldn't solve them.
Hmm.
And over the course of like a couple years, they were able to tackle, I think he has it was like 700 different issues or something like that. And I love it because at the end, he tells this story that they would hold these town halls and there would barely be anyone bringing anything up. And someone said to him sort of offhandedly, well, I guess they just got frustrated that like nothing was going to get done. And he was like,
Yeah.
no, contrary. Like we had fixed so many things, and people sort of they realized that the leadership team was committed to fixing things. So they didn't wait for the town halls to bring up
Hmm.
problems. They knew that if they brought these problems up, just like if they did at a town hall, that they would be addressed. So I thought it's a great example of really seeking feedback, but then actually taking action on it. There's a great quote by Pat Lencioni, who wrote Five Dysfunctions of a Team. And I don't know where the quote was, but I've heard him say it on a podcast that the people who work for you don't expect you to have all the answers, but they do expect you to be working on them. And I thought that Dr. Argyros's, case just illustrated that so well. Again, you can't fix every problem in a hospital. We know that. There's a realism to it. But they want to know you listen and you care about them and that you'll do your best to fix them. And when you can't, you try to explain why. And people, I think, will respect that. But you really have to listen and value their input.
Now, if we have a healthcare leader listening to you this podcast and they want to create that caring, inspired environment, tell us some of the first steps that they should do.
Yeah, first steps. Read the book. I think it's really honestly a simple question. To me, it's one, recognize that whether you're in healthcare or not, that our job is to take care of our people.
Yeah.
And if you just asked yourself the question before any decision you made, how does this decision either support my people or how may it harm my people? I think we would make better decisions. And look, I think leaders sort of ask themselves that question, but sometimes we get lost with metrics and RVUs and access to care. So I think if you asked yourselves those questions, that would be a good start. And then I think the other thing that would be the second point would be consistently, how can I invest in my people to help them get better personally and professionally? So what does that look like? What do you need to be successful? What do my frontline nurses need to be better at their jobs? Do they need maybe an extra break so they can actually eat lunch when they're on shift? Do they need some communication training because they went through nursing school, and while they had some of it, they maybe didn't have as much specific to some of the challenges they're going to have? Maybe they need some other type of training, but what specifically can we do as leaders to invest in our people? Because it goes back to the earlier point, is when someone invests in you, I think we show up a little differently at work. If I know my boss really cares about me personally and professionally, I'm going to work a little harder. I'm going to do my best because I don't want to let him or her down. And I think if you listen to people, you advocate for them, and you give them growth opportunities, it's going to motivate your workforce.
We're talking to Josh Hartzell. He's an internal medicine physician and infectious disease physician. His Kevin MD article today is Leading with Care, How Healthcare Leadership Can Transform Patient and Provider Well-Being. Josh, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Sure. I would say a couple things. The first would be that leadership is really, really important. So if you're somebody who hasn't spent a lot of time thinking about your leadership development, I would challenge you, over the next year to dedicate 30 minutes a week or maybe an hour a month to your leadership development. That could be listening to a podcast. It could be reading a book. It could be just talking to someone who you think is a really effective leader, but make leadership development a priority. Similarly, if you're a leader already, make it a priority to develop those below you in terms of their leadership skills. And then the last point I would just mention, we've talked a lot about us taking care of others. I think it's also essential as leaders, we need to take care of ourselves. If we don't do the things that we need to show up as our best version of ourselves, then it's really hard to lead effectively. That's different for every person. I can't tell you what it is for you, but I think making sure that you're taking care of yourself is also vital, not only to leadership, but also to providing patient care.
Josh, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thanks so much, Kevin.